ask both of you, COVID cases are of course on the rise again in much of the country and have been for a couple of weeks. The city of Philadelphia imposed a mask mandate and then sort of rescinded it. For both of you, under what circumstances do you think a mask mandate should be put back in place in your cities?
I can start if you want.
No, it's a very fair question. The evidence is very clear, masks work. And they prevent the spread and transmission of COVID-19 and other respiratory infections. We've learned a lot throughout the pandemic. We now have a new framework in this phase of the pandemic in which we're in. And many of our jurisdictions have adopted that framework of looking at community levels. When community levels are low, when they're medium, and when they're high. And some of our jurisdictions are in very different places, low, medium, and high. And we also recognize that there are individuals who will have their own risks, right? So there's an individual risk and community level risk that should be taken into consideration. So regardless of what your community levels are, so individuals will need to make choices based on their own health. So they may always be at increased risk of severe illness if they contract COVID, or they may live with someone who's at increased risk. They're immunocompromised, they have cancer, and are undergoing chemotherapy, et cetera. So we fundamentally, believe in the District of Columbia that, when we're at low and medium risk, we really want people to be looking at their individual risk. And when we're at high risk, we will have maybe a consideration of a different posture for that indoor use of masking. But our recommendation is always very clear. Anyone could wear a mask whenever they deem that it's necessary for their own individual risk, their family risk. And many of our institutions have kept indoor mask policies throughout the pandemic because that's what's best for their population that they serve. Many of our entertainment venues, many of our workplaces and businesses have done that throughout the pandemic. And when they've seen a cluster, for example, on their universities and campuses, they've reinstituted their mask policies. And so we've really had this whole of government, whole of community approach for the past 2.5 years, and that's worked really well for our jurisdiction.